Prone kinetic tests. These are essentially kind of the same idea. We're now in quote unquote non-weight bearing, but the only difference here with this is we're going to be bending the knee instead of lifting the leg. Okay, our hand placement ends up being the same. We're going to be on the PSIS on the right, spinous process of S2. And then what we're going to expect here is she bends that her right knee up, is we would expect the PSIS, via tension in the rectus femoris and the anterior femoral fascia, to go superiorly relative to the PSIS. I always ask the patient to move their leg very slowly here so that we can appreciate the movement more effectively. So go ahead and lift that right knee. And there it goes, nice and superiorly. And that's what we would expect to find. That's exactly what we would hope to see on that one. For the contralateral test then, we're going to be lifting the opposite side leg. My hand placement remains the same on her right PSIS and S2. Via this anterior femoral fascia, the rectus femoris, we're going to expect anterior rotation here of the left side to take the sacrum with it. As the sacrum goes with it, we would expect relatively then the sacrum to move superior compared to the PSIS, affecting a relative posterior rotation of the innominate on the right. Now, if this one is positive, which we expect it to be, that would suggest a limitation of posterior rotation of the innominate on the right, especially when we couple that with the standing ipsilateral kinetic test. Okay, so go ahead, nice and slow, lift that left leg. And neither one of those goes separate of the other. Going back down, try that one more time. And you can kind of see there, both my fingers move at the same time. So that would suggest that that is a positive. We just look like we have a tough time getting posterior rotation on this right side based off of the standing ipsilateral kinetic test and the prone contralateral kinetic test. Those two things coupled together.